Hi everyone, my name is Michael Doe. I am a pharmacist and founder of MedEssist. During the COVID-19 pandemic, it is critical that we reduce the number of patients coming to our pharmacies to lessen the risk of infection for both staff and patients alike. At the same time, COVID-19 has exacerbated drug shortages. These two conflicting needs has put pharmacies in a difficult dilemma. Mobile apps can be the solution to this problem for many patients by enabling them to order refills or send in new prescriptions in a convenient and safe way. Due to COVID-19, more and more patients are accessing health services through their smartphone, and many are finding this medium to be a preferred healthcare channel. While it is a very appropriate time to implement mobile apps into your practice, mobile apps can also have significant long-term benefits for both patients and pharmacies. For patients, mobile apps can be an effective tool to improving medication adherence, which is the cause of 5 to 10% of hospitalizations. In fact, there's a meta-analysis which demonstrates the positive effect of mobile apps on medication adherence, and interestingly, the mean age of patients was 56.7 in those studies. Mobile apps can also help patients manage their medical conditions, provide them with a medical record-keeping tool, or be used to communicate with caregivers or healthcare providers. Some apps support multiple languages or utilize an assortment of visual aids, while others enable remote monitoring or virtual care. Mobile apps are a terrific educational resource for patients as well. In some studies, patients are only able to remember 49% of information provided by a healthcare professional. With mobile apps, patients can review information or educational materials whenever they need. Mobile apps also enable a variety of new teaching methods, such as microlearning, test-based learning, or gamification to improve health literacy. Mobile apps can also contribute to a steadier and more predictable workflow by reducing phone interruptions and waiting patients. This can enable pharmacies to implement more professional services, and some mobile apps can directly streamline professional services as well. Spending a minute or two to introduce a patient to a mobile app can save you and your staff a tremendous amount of time, as orders, professional services, and communications with that patient is streamlined for years to come. There are many apps that are specific to certain medical conditions as well. Apps that help patients manage pain, or inflammatory bowel disease, or depression, or help patients in improving their nutrition or sleep. There are apps that allow patients to find caregivers, or a therapist, or a dermatologist as well. There's also a great COVID-19 app funded by Health Canada. The app can walk patients through self-assessment for COVID-19 and teaches patients everything they need to know about the virus and how to protect themselves. One of the great advantages of apps is that they are not a static resource. Patients will continue to be notified of the most up-to-date statistics and health information. Having a few mobile apps that you feel comfortable recommending is a fantastic way to engage and support patients. It often requires minimal effort and can really elevate and modernize your practice. Now let's discuss some tips to implement a mobile app service into your pharmacy. One of the most important things you need to do is to make sure your staff is involved. Your staff needs to understand not only the health benefits that your app service can have for patients, but also the benefits to their workload and the efficiency of the pharmacy. Mobile apps can also be a great way for a registered pharmacy technician to practice at their full scope and provide added value to your team. During COVID-19, putting posters on the outside of the pharmacy can notify patients that they have an alternative way to order their medications without entering the pharmacy. This is especially important if they are symptomatic, but also if they are not symptomatic, since studies have shown that 10 to 40% of those infected are asymptomatic. The way you or your staff discuss the app to patients is extremely important. Patients are more likely to use an app that is introduced as being designed to improve their health, that is recommended by their pharmacy team, or that is used by other patients at the pharmacy. Once your staff has a better understanding of the app, you can begin to incorporate it into your workflow. This can be done at prescription drop-off or pickup as a standard question or introduction that your staff will ask all patients. As more patients begin using your app, it can become a great opportunity to foster greater collaboration with prescribers in your area as they realize the healthcare tools that you are providing for your patients is contributing to better communication and medication adherence.